Hello everyone, myself Veer Vikram Sharma. I am working as an assistant manager come in charge of pharmacy at Dayanand Medical College and Hospital, Ludhiana, Punjab. I have done B Pharmacy and M Pharmacy. Now I am doing PhD under the kind guidance of Professor Sandeep Kaushal. I have got the best, I have three publications. One is with Professor P.L. Sharma, another with Professor R.D. Budiraja, and my recent publications with Professor Sandeep Kaushal. I have attended the National Symposium of Herbal Medicine Application of Biotechnology and Biotechnology. I also invited speaker in BID's 4th Annual World Congress of Diabetes 2015 that was held in Taiwan. I have got the Distinguished Award as a speaker in Current Trend in Pharmacy Practice in 2015. I got the publication certificate from any publications for publications of a research article in international journals of herbal medicines. I was the chairperson of scientific session in International Conference on Advance in Pharmaceutical Nanotechnology and Nanomedicines. So today I have delivered the lectures on LASA drugs. LASA is look like and sound like drugs. So there are few errors whenever occurs according to the LASA. A 8 years old patient was prescribing. In some countries, mebendazole is the generic name and its brand name is Kit Kat. But in our India, Kit Kat is used as a chocolate. So if a doctor came from Nepal, he write the Kit Kat to the patient, mebendazole. In our pharmacist, he should tell to the patient, go to the market and purchase Kit Kat. It is misunderstanding of the brand names. So another name is different categorized, that is, so it is minimize the use of verbal and telephonically prescription. Now it is a trend to call order to the pharmacist for particular drugs on telephonically. The pharmacist should consult whenever he receives the call. He again tell to the patient or anyone who called about the drugs, repeat the names, or if eligible, call for some spelling. So we can minimize the LASA. Even though it is strictly prohibited for telephonically prescription, but in hospital, some nurses call to the pharmacist, they require particular medicine to the particular patient. The pharmacist must be consulted and must be repeat the name of the drugs whenever he prescribed. In pharmacy, it should be must to use the name alert sticker. There should be different cabin for LASA drugs, high alert medicines and narcotic drugs. So whenever the pharmacist prescribes the drugs, he or she should know about which drug to be given to the patient when there is a different cabin for LASA. And setting up a system for reporting error. If there is an error occurring, he or she must be reported to their higher authorities about the LASA drugs. In every hospital there must be medication safety committee. So we can also help to the prescriber, pharmacist and patient about the LASA drug, and the persons who is taking the medicines, he should not suffer about the wrong dispensing for LASA medicines. 8-year-old patient was prescribing methylphenidate, that is metadate, for attention defect disorders. Instead of he received methadone, a similar looking drug, and he died later. Similarly, a 50-year-old woman with complaint of bronchial spasm was hospitalized after taking Flumox, a drug for enlargement prostate. Instead of Walmart's, Volmax, which early bronchospasm. In Nepal, a case is recorded where a pregnant woman who was prescribed the drug Forvin, that is folic acid, was intent dispensing phlotin, that is ciprofloxacin. Later, due to some reasons, there was termination of pregnancy. So the look like and sound like drug. This is my hospital. So the some proprietary brand names and non-proprietary name sound or appear to be similar to other drugs when written or spoken. These confusing names are one of the main cause of medication error. There are mainly sound and look alike drugs that would result in medication error. These errors may cause harm or even death to the patient. According to the result from United States Pharmacopoeia, around 1400 commonly used medications were involved in such errors. A group of medicines that have similar actions often have similar sounding brand names. The generic medicine is one that contains identical amount of the same active ingredient in the same strength and in the same dosage form. When doctor write a prescription, they will nominate the medicines to be used, usually the originate brand name for the drug requires. Certain drugs have names that may appear similar when carelessly written, liable to confusion. Problems are likely if the strengths and doses of the two preparations are similar. Doubt should be resolved by checking with the prescriber. Most cases, mistakes have occurred because the item was dispensed without a second thought. A large number of them have similar sounding or similar looking names, which is a reason for major concern among the prescribing physician. All these factors should clearly be borne in mind by the drug controller while a brand name is approved. Therefore, no two drugs should differ by an alphabet, symbol, suffix, or prefix. There should be absolute clarities and differentiations of the any two drugs, whether the names are spoken or written. Origins of the problems. Confused drug name reported to the ISMP, the Institute for Safe Medications Practice, from July through September 2010. They have given the list of drugs that have similar, that is look like or sound like. That is Depakot. It's also look like Depakot ER, that is extended release. Dexamethasone, dextromethorphan, doripenem, that is Zovirax, acyclovir. Again, this list like tramadol, that is a painkiller, trimazodone, it's given. Risperidone, ropinirole, pitocin, pitresin. So, number of drugs that have mentioned according to the Institution for Safe Medication Practice and Medication Error Practicing Program. Now, the source of error. The main reason for improper dispensing of confusing brand name may be due to the negligence or due to the lack of knowledge of a registered pharmacist or due to the less number of pharmacists during rush hours. When brand name of two or more drugs are similar, faulty dispensing would result from one of the following situations. One is illegible handwriting of the prescribing physician. Another is incorrect dispensing by the pharmacist due to oversight, that is similar looking names. Incorrect reading of the brand name by the patients while ordering the medicines by phone, which is a common practice in some cities in this country. The error-prone drug pairs. Error-prone medications pair that can easily cause confusion while prescribing, dispensing, and administration were sought out. Also, real-life experience of medications error and near missed due to error-prone drug pairs were collected from the doctors and the dispensers. First is LASA drugs, similar brand name and different generic compositions. Example is acinil. Acinil is acyclovir and acipril. Acipril is anapril. Acinil and azapril have similar branding, but their generic composition is different. Again, we can consider the example of Almax. Almax is albendazole and Almox. Almox is amoxicillin. They have similar branding but different generic composition. We can easily understand if we given the amoxicillin instead of albendazole, there is no use for the person who is having worms in his stomach. There is no use for amoxicillin if he not taken the albendazole. Again, one more example is azone. Azone is azithromycin and azone. Azone is esomeprazole. So again, esomeprazole, some doctors have mentioned, is empty stomach. If the patient taken azithromycin and empty stomach, it is harmful to the patients. LASA drug, similar branding, similar generic composition. This is a category 2. In this category 2, the drug example is amlodipine. Amlodipine is amlodipine and amdipine. Amdipine is also amlodipine. So the different brand name having similar generic composition. In this case, one patient is suffering from one particular disease. He is not satisfied from one prescriber, one doctor. He should go to another doctor, have same disease, and doctor write the different branding but same generic composition. So it may cause harmful to the patients if double dose is given to the patients. If we take same brand name, the different same one brand name from the one prescriber, and he take the another brand name, same generic name to the different prescriber, he take both the medicine, it cause the harmful to the patients. So another example is Alret, that is cetirizine, and Alitrin. Alitrin is also cetirizine. Third category is similar branding with additional letters, like Amox. Amox is amoxicillin. It's contain another Amox C, that is amoxicillin with cloxacillin. Another example is Taxine. It contains cefotaxime. Taxine O, that is cefaxine. So there are multiple reasons for LASA drug with similar branding with additional letters. The doctor prescribed one Amox, we have given the Amox C. It is the higher antibiotics. It is additional generic that is added with the amoxicillin. This is the class of LASA. Fourth is LASA drugs, similar brand name with antibiotics. This is the category 4. Example is Rdox. Rdox is doxycycline and Rflox is ofloxacin. Megaclox, Megadox, Megaflox. There is sound is similar branding. So in Megaclox, that is cloxacin, Megadox, doxycycline, and Megaflox, ofloxacin. So